Welcome to the Move You podcast. I'm really excited for today's episode because it is so common. I get this question over all the years. I hear the stories, the successes, the failures of this thing. It is back surgery versus a conservative approach for back pain and sciatica. Which one? Like, if you've done conservative, when can you actually say that you gave it a shot?
Yep.
And then if you gave it a shot, when is this back surgery even going to be worth the risk associated with it? Or is it just worth living with it, which no one has to live with pain? It's choice. So I'm excited for this. I don't know how it's going to go. There should be a degree of suspense from everyone. This is what podcast is this? Faby, this is our second one together.
Yeah.
Okay.
Podcast
4?
6.
Is this 6?
Yep.
All right. This is our attempt. Faby's my attempt to make this fun without any guests in here.
I'm so fun.
She's fun. She's fun. I see Faby's like I want you to be like my Robin for Howard Stern.
There you go.
But she tells like the weather and stuff.
She does?
She used to. Those are old school ones.
I don't think she does that.
Do you know when I was young, I used to, when I was like 8, 9, 10, 11 years old, my mom, I listened to every Howard Stern episode. My mom let me listen to all that when I was young. So that probably molded me into kind of who I am today.
Right. That makes sense.
Yeah. All right, let's get into it. So the purpose of today is for you to get more information. First of all, you need more information on what is conservative, the pros and the cons of that. What surgeries exist? What are the pros and cons of that to help you make an educated, informed decision about what you do? Because remember, these are all choices. You never have to get surgery. It's always a choice. Even if you're in a freaking coma, someone else is making a choice on your behalf. So I want to make sure that you make the right choice, the one that helps you long-term for first, short-term second. All right? So, and this podcast is proudly sponsored by Move You.
Us.
Yeah. Move You sponsors it. And why wouldn't Move You sponsor this podcast? The Move You programs are the most educational, affordable, convenient, and thorough conservative treatment that exists today on planet Earth. Find another one that is more of those, and you get a free week membership into the program. You actually already get a free week into the program.
Correct.
So you can check out moveyou.com to learn more, start your free week trial, and all the programs are built to help you fix the root cause of your back pain so you can live a pain-free life. And so many people choose Move You in the past, and they say this was their last resort.
Right.
And we need to make this your first resort. Okay? And surgery is the last resort. And so it's so easy. Like we had a client the other day. He had back pain. He went to the hospital. Went to the emergency room. Back pain severe. Went to the emergency room. Sat around there for hours. Nothing happened. X-rays. Then he went to a urgent care. And then he did the urgent care. And then he got medications. And then he got a shot. And then it took about an hour before the shot kicked in. So he said it took 7 hours.
7-hour process to get
a
shot that barely helped alleviate the pain.
Right. And you literally could click a couple buttons on your phone and be getting pain relief in a fraction of that time. Yep. So it is that's one of the major limitations actually of healthcare is just the sheer inconvenience and outdatedness of it. But let's get into that in a little bit.
How cool would it be if we were the first source?
I mean, that's the
dream. If we could get people to try us first and then go from there, if we're not the last resort, I really think we could help so many more people.
I mean, you got 85 to 90% of chronic back pain is musculoskeletal. It's the way you move. It's the way your posture.
Yeah.
And so the many people will go for pills in this. Remember, if 85 to 90% of back pain out there, okay, is from the way you're moving, the way you're holding yourself, the way you're bending, the way you're lifting, the way you're sitting. If 85 to 90% of this, and then surgeries, pills, they don't address that.
Right.
Right? It just makes you feel less pain. So, yeah, I mean, the dream is that.
That's the goal.
The goal is for Move You to be first. Right? But you go, actually, the goal
Let me pay $40 for a month Try it.
No, it's 25 right now. Well, it depends on when they listen to it.
Whatever it is.
Yeah.
It's under $100. Let me try it for a month and see what I can do. I mean, come on.
I mean, the results are, I mean, we can get into the testimonials of
Right.
it. It's just, it's like predictable. People are like amazed that their back pain of 6 years is better. I'm more amazed if it isn't better.
Right.
I'm like, of course it's better. You're changing your mechanics and the root cause, and you're fixing the underlying imbalances. So that's the dream. And you know, for you guys out there, share with the world who needs to fix their shit. Let's make Move You first. Yeah, but let's make you the first choice to fix your shit, to prevent everything. So, sponsored by Move You. That was a good plug. You know, the great thing is we can make our plugs as long as we want because we're our only sponsor right now. Okay? Future. Well, hopefully we don't get the hope set up for future sponsors. They get a 12-minute plug at the beginning of the podcast. Overview. So, back pain is still is winning first place award at of the number one cause of chronic disability. So the number one cause of, I really didn't say that well. The number one cause of disability in the world is back pain. That's the number one cause of disability. Disability meaning your inability to move your body, live your life fully, and that's back pain. And as we already mentioned, 85 to 90% of that is musculoskeletal. It is absurd that it's number one. In this lifetime, if we can just get that thing to number two. Hopefully it's not number two because some crazy disease sweeps over.
That's true.
Hopefully we do it the right way, you know?
Yep.
So what you need to understand about back pain is this. There is the source of back pain. That is where the pain is coming from. And the source of your back pain is generally, now remember, I'm talking about the musculoskeletal, 85 to 90% of you. That back pain has the sources is either muscular, the pain comes from a muscle, the pain comes from a nerve, the pain comes from a joint. That's it. Those are the three sources of back pain. Now, that's the source. Then we get into the cause of back pain. The cause of back pain, remember, the source of the back pain itself, to feel pain in the back, it requires your body's really freaking strong. Like there's some crazy shit that we do with our bodies, and our body absorbs shock really well. But when you abuse your body unknowingly, your body now, it takes millions of repetitions, hundreds of thousands of reps and things done wrong before that pain is felt. And so now you get into the cause of back pain. And to make it really simple, body misalignment. And I'm trying to very simplify you. Misalignments in your body frame are the cause of 85 to 90% of your back pain. Now,
constant repetitive movement like crap.
Constant, it's more like, you have
a misalignment.
Crap alignment combined, and then with the crap alignment,
you're adding
reps and sets
repetitive,
and
terrible
movements and sitting around this crookedness.
Yep.
Some of you might say poor posture. Some of you might say, I can't hip hinge, or I'm in hyperextension in the back. Those are all types of misalignments. You've got uneven hips, scoliosis, rib flare, hyperextension, excessive curvature of the spine. We're talking about the low back. We have, you could even say slight scoliosis. These are all types of misalignments. And now those done thousands of times start to cause predictable wear and tear on the joints, on the muscles, on the nerves, which cause then you to feel the sensation of pain. Then let's go one step deeper into, well, what causes these misalignments? And these go back to coming out of the vagina sideways. Right. That'd be tough sideways. You have to fold in half.
Okay.
You come out foot first, you come out head first, you come out with a big suction cup on your head. Literally, this stuff can start. Also, developmentally, like our bodies are designed to physically develop throughout different phases of our life. Like, for example, you look at a 3-year-old. They got this big sway back in the stomach. They look like they got a beer gut. They're walking around happy as can be, no shirt.
But it's super cute at the time.
It's super cute at the time. But now that child hasn't hit yet the core development phase. And so I forget the exact time frame of core development phase, but if your kid is you're playing the right sports, or maybe it's you, right? If you're playing the right sports, you're outside playing, moving your body, in that time frame, you'll likely develop your core properly and probably won't have issues with it. But if you miss a phase, then now you are, in a way, have developed that now it becomes a misalignment because it wasn't corrected. And of course, you got the sports injuries, playing football, the wax, falling off a ladder. Then you got traumas, car accidents. Like, these are all things that can throw your body out of alignment. And the body doesn't really care to put itself back into alignment. It just it just puts itself in a position.
How do I get away from the pain?
How do I get away from the pain? But this is how your body talks to itself, not even your brain. Your body just does these things as you're, texting and swiping up on Tinder and stuff and wondering why you're not getting many likes. Why am I not getting matches? Well, the opposite sex or same sex, we're attracted to symmetry. And if you're not symmetrical, well, you lose a point off the old 1 to 10 scale.
Swiping left on you.
Swipe. I don't know and the person's like, I don't know what it is, but no. Yeah. So take a look at your pictures. See how aligned you look in those. So now you have, you've got these underlying issues that cause the misalignment, and the misalignments over the course of time produce the wear and tear upon the joints, the discs, the nerves that cause pain, right? And so now and I told Faby, you guys need to know this shit, all right? I'm obviously biased about this. I've been in the healthcare profession for 23 years. I've worked side by side with every doctor possible, with the VA. I've traveled abroad working with clinic abroad, with third world countries. And if I thought that chiropractic, physical therapy, massage, surgery was the solution for back pain, I never would have started Move You.
You would have stayed where you were.
I would have
stayed that's where you were.
I would have stayed where I was.
That's where we met.
That's where we met. Yeah.
Yep.
Faby was a patient of mine. She was in a car accident.
I was in yeah.
Was it a bad one?
Yeah. Teenager, texting, never saw the red light.
Oh, yeah.
Yeah.
Oh, you were rear-ended?
Mm-hmm.
Oh, yeah.
With my kid in the car, remember?
Oh, I didn't know Kay was in the car.
Yeah.
I need to take a look at her.
But yeah, you were there.
It's been a while.
Yeah.
Last time I looked at her was like 2 years ago at old Move You office.
Yeah. But that's where you were, and that's where you would have stayed. And I remember you telling me about Move You and what you were thinking about. And I was like, at the time, you were helping me heal so rapidly that I was like, what are you talking about online? And you were like, I want to do this for the masses. And I was like, but what you do is here, like in person. I didn't get it at the time. I so get it now.
I didn't even get it the early days.
Yeah.
Because we made some old YouTube videos that went like viral, and people would say to me, I remember them in the videos, they go like, how can I do this here? I'm like, you got to come into my office.
Right.
You live in Somalia, fly over here.
Right.
And some people did.
Totally.
Well, and that was the kind of the start of it, was that with people, whenever we started growing on Instagram and social, people were flying from different countries, and they would see me for a couple of days, and then they would just leave.
Yeah.
And I'm like, well, what do they got?
Right.
A few exercises that I gave them. There's no continuum.
Right.
And that started the programs, like some for you guys to follow.
So of course you're biased, but
of course I'm biased.
This is what gives results. We've seen it.
We've seen it. Now, we've seen the results, but also there are times where back surgery is necessary. And so now I'm not a surgeon. So if I had an orthopedic surgeon, which we might have in the future here, an orthopedic surgeon on here, given some more details on this and some more specific examples, I'd love to have that. But right now I'll also go over with you today some of the pros and cons of surgery, the types of surgeries. Wait, is that where we are?
Yeah, the only thing we missed was the psychological part,
Oh,
right?
yeah. Well, the psychological part of pain is...
It can be a huge one.
I've seen it with my eyes. I used to think that I remember specifically I did a landmark for him. I don't know, I've given this example before. It's like it was actually ALA, Essential Leadership Academy, and I remember seeing this woman, and she actually I was irritated by her at first because I've never seen her posture. She was curled up here, and she was miserable looking, and I wanted to just kick her in the back.
Oh my God.
I just wanted to drop kick her in the back and get her in some sort of a BDSM. How fast can I just pull this back and push this part forward to crack her into position? Okay. That's what I think. Those are the things I think whenever I'm like spaced out in seminars. So if you're in a seminar with me, just know I'm probably creating stories about what I would do to your spine to straighten it. Anyways, so this woman, she did ALA, which is like, we go into like the past emotion, like we go into past traumas in our life and you release them, and then you play all different exercises to clear out the past. And I remember the last day I watched her walk in, I didn't even know it was her.
Really?
I'm looking at her, I'm staring at her now, uncomfortably staring at her, right? I'm just staring at her, and I think she looked at me and just turned away, but I kept staring because I'm like, what, is this the same person? And it was. She was like, her posture was upright. She was happy and confident.
Interesting.
Never did a single move you exercise. So psychological origins for sure exist. Now, psychologically with musculoskeletal issues, really simply what happens is when you have especially chronic pain, you develop chronic pain or issues like you go back 10, 15 years ago with your pain. Well, if you have had constant episodes of pain, right, that put you back, you now have, there's depression. Depression is sadness of the past. Your kid's baseball game that you missed, that you couldn't go skiing with your buddies. Like those are all now, it's sad to think about that.
Yep.
And then you have anxiety now, anxiety is fearing the future, right? You now go, your wife's like, hey, let's go zip lining. You go, you feel anxiety about the future because you don't want your back to go out and you to let go and be dangling 200 feet in the air, which I was just thinking about our zip lining in Costa. That video was sent.
Yeah.
I went upside down. I saw what it feels like before you die because my whole world turned into a kaleidoscope. And I'm like, oh, my body's preparing for death.
I was terrified. I was screaming watching you.
Yeah. It was a very provocative looking position too, but I wasn't in the front row audience of what that looked like.
No.
So, where was I, Faby? This is another reason why.
That was
here.
it. We wrapped it up. Conservative approach overview.
Okay. So the conservative approach and what that generally is, generally speaking, if you get the healthcare bubble, right, this whole healthcare, and let's put alternative care within this circle. You've got chiropractic, you have physical therapy first. You have chiropractic in there. You have massage therapy in there. And then you get acupuncture in there. And that's pretty much the conservative approaches. Now, one conservative approach, and let's just call it minimally invasive, would be pain management. All right? That's
barely makes the cut.
Barely, it barely makes the cut. So now let's just talk mostly about conservative care approach. The number one con isn't I don't believe it's the actual practitioners and doctors. I believe it's the system because I've been in it. They're dictated and ruled by insurance. What insurance pays is what they do. If insurance doesn't pay it, they often don't do the procedure because they don't make money off of it. And often insurance pays for some dumb shit that doesn't really even work, but it makes them more money, so they'll do those things anyways. And so the insurance it can cloud it makes it difficult for the practitioners to do what they feel is best because they can only do what they get paid for.
Yep.
And they get paid less and less and less, so now they spend less and less time with you, right? And then you get soon it's not even your physician's assistant anymore. It'll be the
assistant's assistant.
The assistant's assistant monitoring your care in physical therapy.
Financially, though, that can be, the insurance can be such a shit show.
Usually, because it's
like I have to pay a copay to tell my doctor that I think I need chiro. If my insurance even takes chiro, which now I don't really need.
You got to convince him. Then he's got to write you a script.
Right. I have to be referred. It's such a. I can no longer call and ask for that. I have to come in, pay the copay to get referred.
Oh, so you're going backwards in time even further.
No, I'm not kidding.
You can't even call anymore?
At least not mine. I have to come in either virtually or in person.
Yeah.
They collect their copay, and then they'll refer me.
You seem to know a lot about this referral with chiro and PT, Faby. You better not be cheating on me.
I don't even have coverage.
Good. So it is so incredibly cumbersome, slow.
Yeah.
It takes the time, the driving, the verification, and then you're limited to certain visits how many visits you get per year. And the environment, this is why 70% of people drop out of PT by their third visit. I mean, it's just often. And then the environment isn't very inspirational in there. You're just usually left with,
It's sad in there.
you got like two 85-year-olds. You're doing the same thing that they're doing. And it smells really weird in there.
That's exactly what it is.
Yeah.
And then you come home and you don't do that shit.
No, because it's like it wasn't a good experience doing it in
No,
there.
I'm not inspired to do those exercises.
Right. But people go there for like motivation. I'm like, you weren't even motivated by physical therapists? Like, no offense to them, but that's not what they went to school for. All right.
Totally.
That's the biggest.
It's not great.
That's the cons of all of those too. And that also goes for chiropractic as well. Less with massage, because massage is with insurance, it usually covers the massage still. That was mostly physical therapy. Chiropractic, but the pro of physical therapy is this. If we're talking about physical therapy, the pros of physical therapy is you are going to go in there and you're going to get generally regarded as safe exercises to begin, right? You're going to have somebody staring at you while you do something. You're going to be going through generally regarded as safe exercises for the back. And if you're not doing anything at all, it's going to help you, right? Now, I do know some great physical therapists that aren't in this category. And I want to be clear. I'm talking about what I've seen to be about 85 to 90% of the experience
Right.
of most people.
It's not all.
It's not all. But I put my money on it every time that it is. And I win 92% of the time.
Not all, but most.
Not all, but most. But the pros are, if you get a good physical therapist in there, right? They've got a good plan. They know what's safe to do, and they know how to safely get you in different positions and movements that can help you moving better and getting more strength and more mobility, and then progressing you from positions maybe on your hands and knees or on your ground, to positions on your knees, to positions standing, to moving, to maybe moving with weight. But often, here's another limitation, is that insurance only covers pain. So when you're out of pain, if the therapist or doctor says you have no more pain, you're cut off. So they either have to lie about it, but because it only covers pain, you literally are only getting the pain relief exercises. Unfortunately, that pain relief exercises are like, they get you from being in debt on your credit card to your account balance of 0, and then that's it.
Right.
They usually don't see people long enough to take them from 0 to actually building up a piggy bank of savings, and alignment and strength.
Right.
So you got this huge gap between being able to like live your life, being able to like, you got to, especially if you're trying to get back to doing something active like running or swimming, there's a massive gap.
Yeah.
You got to close it on your own, or you've got to find someone else. People that can help close that gap are like a good personal trainer can help close the gap too, because there's an overlap. Physical therapist, personal trainer, right? There's a PT first, tag team, trainer. That's out of pocket, but that actually would be how to close the gap to using that route. Where am I, Fab? Help.
That's it. We're understanding back pain.
Oh, okay.
Back surgery, sorry.
Oh, here we go. Let me switch my thing up. There we go. So physical therapy, chiropractic, pros and cons. Pros, if you have joint pain, meaning SI joint pain, facet joint pain, maybe even like spondylolisthesis, hip, and I'm talking specifically just about the back. Most joint issues, a chiropractic adjustment frees up the joint. It moves and mobilizes the joint and can provide temporary relief. It can provide increased mobility for a period of time. And that's a great period of time if you use that new mobility. If you use your new mobility and strengthen into it and gain awareness of the muscles that pull you into that new mobility, you've now made permanent change. But the limitation with chiropractic is that they often don't teach you that because they just get paid for an adjustment. And so you end up getting usually a mill where you spend a few minutes with them, you get an adjustment, and you come back 3 times a week for 4 weeks, twice a week for 6 weeks, once a week this, and then maintenance once a week forever. And unfortunately, the game with chiropractors, as many of them, most of them, is they're trying to see you the maximum amount of times they could see you in a year. So that's not always the case. You get sports chiropractors that aren't. And some people just love getting adjusted too. They just love.
I do.
You do.
I was scared when you released me. When you were like, "You're good," I was like, "Oh shit, I am."
I'd have people just show up at the office I'm like, why are you here still?
I mean, I saw other chiros before you, but you're one of the first ones that were like, you're good.
Oh,
You can go now.
get out of here.
I don't need to see you anymore.
Go live your life for God's sake. Don't you have
Totally.
something else to do?
But I do think it kind of becomes addicting.
Yeah.
You're like, oh, that felt so good. And then you feel good for a short period of time. And then you feel like you need it again.
Usually because the chiropractor itself, chiropractors are very good at understanding postural misalignments and correcting those postural misalignments with force of an adjustment.
Yep.
Yet that adjustment most often doesn't change our negative movement habits, the way our posture throughout the day. It doesn't change the underlying it doesn't change the underlying, not the muscular imbalances and ingrained patterns that come with it, which is why I see in chiro over and over. Now, I also want to mention something else with chiropractic. I've personally adjusted people. I've seen miracles happen that aren't just pain relief and movement. I've adjusted people and literal miracles have happened. I don't want to get into details. We don't have time for that. But
I mean, I think what you're saying, though, is that you're not saying don't go get adjusted.
No.
Sometimes that can be helpful.
I would really like if people
Don't make that
your
only source of what's going to take you out of pain.
Exactly.
Which is what we're talking about.
Your only source. Right. And that's a good point. Because most people if you get somebody with different joint pain, if they could go through our programs, get adjusted periodically throughout the way, that's the best case scenario.
Perfect. Yeah.
Just like me, I still work with people here one-on-one, and I still adjust people here too. So it shouldn't be your number one. You shouldn't rely. Let's just put it this way. You shouldn't rely on any person to fix you for you.
Right.
That's it. Okay. You can only rely on yourself.
Yep.
Then you get into massage, pros and cons of massage. Number one, it feels good, right? I fall asleep in massages. I haven't had one in a while.
Yeah.
I love it.
You've already kind of done that.
Oh, I did?
Yep.
I didn't say massage. I kind of did a little bit. Massage opens up tissue. This segment's taking longer than I thought.
Because you keep going back to it.
Oh, do I? Massage, acupuncture. Acupuncture uses Chinese meridians. They've been around for thousands of years. There's truth to those. They use needles to stimulate these meridians, which can help with healing. Personally, I've worked side by side with acupuncturists. I really haven't been too impressed with the acupuncturist ability to help manage chronic back pain. I haven't been too impressed. Massage is also a great mobility tool, part of your recovery, but it doesn't do anything for the way you move your body. But also great, if you've got a big knot in your low back, by freeing that knot up, can allow you to side bend, laterally tilt more into the side to open up the QL that might be tight and compressing the disc on that side. So it's a great tool for more of your recovery and some of your tissue mobility. But incomplete. It's a sliver. It's a piece of the whole pie. All right. Understanding back surgery. Back surgery. Let's talk about it. There are 4 primary types of back surgery that exist today. Number 1 is the discectomy or microdiscectomy. That means this. You have a herniated or bulging disc. It's pushing back into the nerve. The nerve is radiating pain down your leg. It's either causing weakness or numbness. And what they're going to do with a discectomy, it's a little more invasive. They're going to cut a little bigger hole, go in there, and they basically cut off the piece of the disc that's hitting the nerve. They cut off a chunk of it, right? And a microdiscectomy is basically just smaller incisions, smaller cuts. So we have microdiscectomy, discectomy. Then we have laminectomy, laminotomy. Those are mostly for people who have issues like spinal stenosis, which is going to be an overgrowth of bone in the inside of the canal, and that bone slowly pushes on the nerve. That they're going to go in there, remove part of the lamina. They're going to roto-rooter the bone out. They're going to remove that chunk of overgrowth in an attempt to free your nerve of being compressed. Then you have your disc replacement surgery, which is relatively new.
Like a full disc?
Yeah.
No way.
Yeah. So
Wow.
I personally haven't seen great results.
Sounds terrifying.
I really haven't seen great results of this. Basically, they'll say, hey, you have no disc left at all, or your disc herniation is so bad, or your insurance company covers this, so we're going to do it. I mean, you got to remember, guys.
That really sounds terrible.
Yeah, and so what they'll do is they go in there, they'll decompress your whole disc, and then they're going to put a fake disc in there.
Wow. And
And then they set it on top. So that one is new, and you could obviously tell how I feel about that one.
what's a fusion?
Fusion. Fusion's whenever fusion is what you don't want done to your low back out of all of them.
I feel like that's what I hear the most.
No, it shouldn't be. And here's how it usually goes. It usually goes like this. You get one discectomy of the back, and then you blow that one out again because, you know, the surgery is not fixing the root cause.
Right.
So you're still going to move like shit. You're just going to blow out the next one.
Right.
Then they're going to do another discectomy. And after number 2, they fuse the back. And this one is, guys, you want to avoid this like your life's on the line, because it literally is. What this is this. It is like an erector set. Did you remember grow up with erector sets at all?
Erector set.
It is the most crude. Martine, maybe put a little something on the screen too.
Put your mic up.
Martine's making noises at me. Oh, there we go. So, a fusion is this. It's where they're going to take 2 vertebrae all the way to your whole spine, and they separate them, so they decompress them when you're knocked out. And what they're going to do is they're going to put screws and plates. They're going to put 2 plates between each 2 vertebrae, and then screw those in place so you can't compress and bend.
Oh, shit.
Yeah, and so the most common is going to be a L5-S1 fusion.
Wow.
And I think the second is L4-L5. Third common is going to be your whole lumbar spine. It is so gnarly. And don't think that you're going to be out of pain with that. You will still be in pain. But this time, this is where you have little control over what you can do about it. Because
Right.
if you're fused in place, just think about the bolts and the brackets in there. Like, it's not like you're going to feel no pain. You got the hardware in your back.
Now you have hardware.
And you can't adjust your spine out of pain because it's constantly stuck in the position.
Oh, my God. It's making my back hurt.
Well, you know, one of the most common surgeries out there is it's a procedure that fuses the entire thoracic spine for scoliosis. And that is done prematurely on millions and billions of kids every year. They just literally, the whole thoracic spine is bolted all together.
Oh, my God.
The whole thing. So that one is, those are, guys, most of these are preventable, and you should invest. This would be something where, to prevent something like this, if you would fast forward at your life, right, and 30 years out from now, and you look back, let's say you had that back surgery. Let's say you had a fusion. In 20, 30 years from now, you would look back at your life and realize, you go, I would have invested everything I had in me,
Right.
in my life for a year or 2 to prevent
Right.
this misery that's come with this for the next 20 years.
Yep.
So I really want you guys to understand that perspective of what you literally should do to avoid something like that.
Yep.
So when is back surgery considered? So there are times, like I mentioned, these surgeries, there's sometimes they are necessary. Bowel bladder incontinence, meaning you're pissing and shitting yourself. Okay? You can't control it. All right? Fortunately, I got over that a few years ago, and it wasn't back related. But if you have bowel and bladder incontinence from a back injury, you now can be compressing on those deep nerves, the S1, S2, S3 nerves that control the bowel and bladder. That could be surgically necessary to fix it at that point of time. Literally, it's almost like sometimes, it's sad. It's like almost like the best answer is to drop a nuclear bomb in the city and clear it.
Yep.
You're going to have major consequences after, but sometimes the nuke, you wipe it out and you start over.
Yep.
Trauma with significant force. I want to be clear here. Doing a deadlift is not trauma with significant force. All right, picking up a pencil off the ground, hurting yourself. That's not it either. Breathing, coughing, sneezing, hurting yourself. That is not either. A trauma with significant force is I fell off my 2-story roof and I landed on the back of my head and I caused a massive compression injury on my L5S1. That's significant force.
Yep.
Not a fender bender car accident, not even one usually at 20 miles an hour. This is like a 60-mile-an-hour head-on collision. Many people, this is where it gets really blurry, because they'll say, well, what is significant force? Well, I did a deadlift. These things usually, those lifestyle and minor accidents usually do not warrant surgery.
I've personally seen you and have shown you MRIs of friends of mine, and you're like, I hate to say it, surgery is the way to go here.
Sometimes because I'm like, I feel bad. I'm like, you've let this go.
Right.
You've
Right.
let this.
There are times
go
when
so long.
Right.
Without addressing. Like I had a client yesterday, a new client, 29 years old. His back is like.
Yeah.
I don't want to say like a 50-year-old, because you can have a 50-year-old. I'll tell you one thing. When I'm 50 years old, my back's going to look great. Extremely degenerated back at 30 years old. So he is, I forget where I was going with this one.
Just that there are times where
he doesn't need it, but I'm saying that this is
him 20, 30 years
letting that continue.
And you told him that yesterday.
Yeah. I try to say it in a way it's positive, though,
no,
too.
you were good. Like this, I'm glad you're in here, because 10, 20 more years of this, it's not going to be good.
Yeah. Then you're left with like, your decisions are like, it's like the worst or the second worst decision.
Right.
Yeah. So, yeah. And also some other ones, if you have like fever, like if you start getting like a really bad fever or sickness associated with back pain, that could be the sign of like spinal meningitis, which is something a medical emergency with the back as well. And lastly, there's more, but progressive weakness, meaning your leg, you walk on it, it's weak. A month later, it's weaker and weaker. And the thing with nerves is if you have something hitting on a nerve for long enough, that nerve, it may never heal fully again. And so there's time where it's worth going in there invasively, cutting out a disc, cutting out a piece of a bone to relieve pressure off that nerve, so the leg has a chance to regain its strength again. And so that is a consideration. Those are definitely some symptoms that would warrant going in,
Yep.
getting an MRI of the back. Okay. Water. I talk a lot. Jeez. I guess that's what I'm doing here.
You're talking.
I'm talking. Oh, so the benefits in the surgery in there would be reduced pressure on that. And spinal fusion. Oh, man. I truly don't know under one circumstance I would ever get it. It would have to be such a massive crushing injury for me.
Right.
Like I'm literally hit by the garbage truck going 50. And my back is like crumbled into bits. Like
Yeah.
It would have to be that type of trauma.
Right.
Have to be that type of trauma.
Pros and cons.
Okay. Well, here's the big pro of back surgery. Okay, especially if you can usually expect on those surgeries you're doing it for an expectation. You can expect 50, 60, 70% reduction in pain immediately, or at least like within a short amount of time afterwards, right? Because the disc is being cut off that hit the nerve, and now it cuts the disc off. Okay, the disc bulges outwards and hits the nerve, so it basically just cuts this part of the disc off. Now remember, that thing's going to start pushing back to the nerve again.
Right.
But it is going to buy you a window. Like you'll likely get pretty fast pain relief, a window of time. So that's a pro. This is the con that isn't talked about, though.
What?
In theory, people go this. They go, I'm going to get my back surgery, and then I'm going to really go all in with my rehab. What do you think? What happens 95% of the time? This is so important for you to know this.
They don't.
Why?
Because they never did to begin with.
Oh, that's good.
That's such bullshit.
That's really good, actually.
Why would they?
Start then.
Yeah. Now, after surgery, I'm
Damn.
all in.
You know what's interesting is it reminds me, this is when I have a degree in psychology that I paid $40,000 for. I think I remember two things. One thing I remember, who even knows how data was? You know what the number one predictor of regular exercise is? This is our previous regular exercise.
Right. Previous history of
Regular-
non-exercise
That,
is a good predictor.
Also, that point you made is great. The point that I was going to make is a little different. It is that pain is the greatest motivator. It may be the greatest motivator in the world in general.
That makes sense.
You take pain away.
You're like,
I'll
good.
get to it. I'm good.
I don't need a rehab. I'm fixed.
Or you'll do like 6 weeks of basic stuff.
Right.
And then it's because pain is a great motivator. And now what happens is that surgery is cut. The pain is relieved enough for you to resume what you were doing. In the back of your mind, you go, yeah, I'll get to it. But oftentimes when you get to it again is whenever you re-injure the area, re-exacerbate the injury, re-herniate the disc, and you go, here we are again.
Major setback, and you're like, oh,
Now you're number 2. If you get a surgery, now number 2. Number 3 is that fusion. So that is, but it's a great thing. It's like, you didn't do it to begin with.
Right.
The truth is with pain is if you knew what to do, you wouldn't be in pain. I mean, that's the ultimate truth. That's a great point. Risk and complications. It's been a brutal even the last few months for me. We have one of our big fans on Instagram. Her husband had back surgery. Complication. He's almost died. He was in the hospital for 6 to 8 weeks. One of my clients, comedian, simple back surgery, almost dead again.
Almost died.
Dead again from infection.
Yep.
And I think there was like 2 more recent ones in there. So there's risk, guys. I mean, they're cutting into your body. They're cutting in and they're going inside of there. And not just the risks of it not working. That's a big one. I mean, when people go, will it work? It works temporarily, right? The surgery works. And if you're lucky, it'll last. If you're lucky, it'll last indefinitely. It's luck. Because basically you've been moving like shit. You get a surgery, it cuts off the problem, and you continue moving like shit. Yep. And then hopefully you'll die before the problem comes back. But it's like on its way. So, those are the complications that you got. Infection, re-injury doesn't work. They cut into something. They can damage a nerve. There was another one too. What did they do? I think they whacked a nerve and they gave some guy temporary paralysis. I forget. These are the guys. This is just in the last couple months. Okay. Oh, we got through it?
Conclusion, baby.
We're at the conclusion? Okay. Let me try to conclude this one. Well, back surgery or conservative care. And what do you do? Back surgery versus conservative care. And I guess we didn't even let's talk about the general process. For 95% of you, right, the best path for you is to go all in with a conservative approach. And that means all in, like you need to understand this yourself. You need to feel your muscles working and strengthening and lengthening and feel your hips aligning. Like you need to commit to that path like you were committed to getting a college degree, like you're committed to learning to play the piano, to play at freaking some piano bar, like you invest in your career. All right? It's that level of investment. It's not like I did 12 sessions for 12 sessions over 6 weeks and it didn't work. That ain't not working. That's not what it takes. You need to know it takes dedication to fix your shit, and then you gain this awareness that you can now maintain it. That's why it's just like wealth. When you get the more money, when you make money, if you're doing it the right way, if you make it, you save it, you learn it, it's easier to maintain that wealth. The lottery winners is like surgery or the quick fix. You're up and then you lose it all because you never worked, you never earned it. So you have to earn a pain-free life. It's not going to be given to you. All right. And I want to stress that to you as much as I can, that earning could take a period of time of commitment. I've seen it. What we in our programs, we have something called the Move You 30, meaning you commit to 30 days in a row of Move You, hell or high water. I don't care if you get pneumonia, you're doing your pelvic tilts in the hospital bed.
Right.
All right. 30 days in a row of at least 15 minutes a day. And what I could tell you is this, is that After that, you continue. And then we have a movie 30, 60, 90, 120, 150, all the way on indefinitely. And I could tell you this, is that somewhere between day 1 and day 70 or so, that is that time frame of consistent work, but that's the time frame needed before you have a major breakthrough. One that you go, oh, the light comes down, you know, you see God, you see Allah, whatever it is, you see yourself, you connect with, and you have this breakthrough, and you go, I get it now. Like, and you look back at your life and you go, wow, it's so clear to me how I got here. You see back at the time, the way you bend, the way you lift, the way you sit, and your lack of awareness in those things. And now from that point forward, it's easy. It's easy then because you know what to do because it feels so good. It's like high-speed internet. You got it. A lot of people don't even know what it was like having dial-up.
Right.
Once you get it, you just go, you keep it.
Yeah.
So it takes about 90 days straight of commitment, of progressive work, of improving, being able to get back to your movements. Remember, your body is designed to do 7 things only. It doesn't matter what sport you're in. See if I can get them all, Faby. It's designed to hinge, to squat, to lunge, to rotate, to walk, to push, to pull.
That was it.
Rotate.
You said rotate. You got 7.
That's all it's designed to do. So all those movements, you must get back to being able to do all 7 of those movements with confidence, and you could say with little pain, or with pain that you feel that doesn't scare you.
You can tolerate it.
Yeah, maybe tolerate it confidently. And so all of your movements, all of your exercises should be designed to get you to do those things. And so 90 days to do those things, and and at that time frame, for myself, if I had disc surgery, if I had a disc injury, you go 90 days like this, if you don't feel even a slight tinge of improvement in that 90 days, then I personally would probably go in to get maybe some scans done, get an X-ray and get an MRI to maybe get more specific and clear on the issue and to confirm it is something musculoskeletal. And at that point, maybe then it might be helpful to introduce something a little more, maybe if it's something maybe like PRP injections, some stem cells, something in there to kind of accelerate the area. And then, oh my God, I can't even put a time on whenever I would even get surgery at this point. Like if I just had, the back pain that 90% of people deal with.
Right.
But so then that point, you figure, really, realistically, I'll tell you that 1 year, a year of dedicated work, like 30 minutes a day, 1 year of work on your body. And at that point, 1 year goes by, you're like, I'm still excruciating pain. I would say 1 year, it would be a green light to choose surgery if you qualified for it. I'd say a year.
It's not a long commitment when you're talking about the rest of your life.
Yeah, right. It's not a long commitment when you're talking about the rest of your life. It's only a long commitment in the short term.
Right.
Yeah. That was like a Robert Greene. He's like, imagine, and I think about this one. He always says, put yourself in the future, like 30, 40 years, and look back. What is 1 year of your life? It's a blip.
Yep.
It's a blip. So that is
commit to it.
And I would then do this. I would do that time frame, and maybe at the 6-month marker, maybe there might be some things to consider to kind of maybe try to kick it. Maybe that 6-month marker with radiating pain, maybe a cortisone shot, maybe trying some pain relief medications to help you. The only reason that I would do pain relief, and I recommend it, is to give you confidence in your movement. Not give you confidence that you can run again, but give you confidence to get that because you need to know that your body is stuck. If you know your body can't extend because of pain, then to introduce, let's start with more of a natural anti-inflammatory, even getting into super antioxidant diet, going heavy into an alkaline diet, fruits and vegetables, getting into natural anti-inflammatories, even natural pain relief, which one I love is kratom, Kratom. Getting into those to help give you a little, so you can feel a less pain, so then you can get into that movement that you've been unable to because of pain. right? And you maybe even could introduce those natural ones even sooner, maybe the 30-day, 60-day, 90-day mark. But you remember, you don't want to dilute your pain so much you don't feel it, because you will dilute your motivation. And that's a fact. I've seen it over and over again.
Yep.
So 1 year of work, this progressive strengthening, mobility, getting back to your functional movements, improving your alignment, right? Lifestyle modifications in there. You can improve the way you sit at your office, get a sit-stand desk, improve the way you sleep, really invest in you're really going to invest in improving the way you move about your life and your daily activities. Then you've got your natural anti-inflammatories and you've got your natural pain relief. Then after that, you can now get into more of maybe a pharmaceutical grade anti-inflammatory pain relief pill. Then, if that doesn't work, you get into then maybe a cortisone injection, more invasive in the back, okay? Then, after that, get into more of if you qualify, maybe a radio frequency ablation to kind of wax some nerves. Then, after that, that's still not getting you results that you want. You're not getting the results. Then, maybe consider, if you qualify, like a discectomy of some sort, on the back, a discectomy, laminectomy, laminotomy, okay? Then those fail multiple times. If those then fail once, twice, then it goes into like the fusion, and that's it.
Where are you going?
I have no room left on the table. I got 1 inch. I'm leaving myself 1 inch for something I didn't think of.
Is this the cliff?
I got here. That's the cliff, and then you die, and then it's over. So that would be my best recommendation for you guys long term to fix back pain. And also the last note here: do remember that consider surgery to knock off if your pain level is consider surgery to give you no better than a pain level of a 5. So if you're an 8, it would take you to a 5. If you're a 10, it would take you to a 5. Right? Don't ever think that if your pain level's a 3, don't think surgery is going to take you to 0.
Yep.
Okay. You got to remember, surgery has this thing. So surgery is going to keep you into a 0 to 5 range in there. So that's the conclusion about improving about how to fix your body. And of course, I highly recommend you guys start in our program. It's our Pride and Joy. We've invested thousands of hours. We have hundreds and thousands of testimonials of life-changing stories of people like you who have tried everything and then now are living pain-free and getting back to things that they never dreamed were possible, right? They've been in chronic pain. They're surfing, they're kayaking, they're hiking again, they're playing with their kids, and they're doing it. They did it by themselves because they learned their body. They fixed their shit. And so I highly recommend that you go in there. You have nothing to lose. We always have a free week trial, at least for now, unless you listen to this in 4 years. So I don't know what the hell we have then. I don't know what it is. But right now, you go to the website,
check it out.
MoveU.com, start your free trial, commit to the MoveU 30, go fix your shit. Thanks for tuning in. Hopefully you like this one. Leave comments for me if you like it and how to make
Don't
this
leave
better.
them if you don't.
Don't leave them if you don't. You can tell me how to improve it. But give me the sandwich, what I liked, how to improve it, and then remind me of what you liked again.
Good job, Dr. Mike.
Thanks for listening. Thanks for tuning in. Fix your shit. See you guys next time.